Welcome to the Whiskey and Wisdom Podcast, coming to you from the Cargo District Recording Studios in Wilmington, North Carolina, where we discuss the most fascinating topics of life. I'm Tyler Yaw with my co-host, Chris Kellum, and each week we interview a special guest to learn how they acquired their wisdom over a glass of whiskey. So, sit back, pour yourself a glass, and enjoy Whiskey and Wisdom.
Welcome back, everybody. As per usual, you have the amazing team of Whiskey and Wisdom. It's your boy Chris and the constant co-host.
I'm Tyler Yaw.
This week, we bring on someone who has way more education than both of us combined, and her name would be
Dr. Hilary Rutledge.
I like the doctor.
Yeah, it's the first doctor we brought on.
Yeah, first for everything.
Fun.
This week, we are talking about health and being better in life.
Wellness.
Getting better? Wellness. There you
go. All of it. We had Sarah Aldon with Upper Health, and we thought it would make more sense to bring a doctor who's been a little bit more holistic in nature and talk about that and what it means. And with that being said, we are not drinking whiskey this morning because we're talking about wellness. And I guess today we will be drinking Blue Cup coffee from the Cargo District Recording Studios and water.
Yes. I'm drinking water. We did the open for CrossFit yesterday, and I am just so sore. I'm like, let me just drink more water.
Yeah, I'm going to have to flush out those toxins out.
Gosh, it's so ridiculous.
And something else we got to shout out too is you will notice that our social media has been upgraded by the time this goes out, and we have partnered with Sway Creations, and they are now taking over part of our Instagram and some of the short form video that you're seeing. So I just want to give them a shout out and thank them for all of the help that they're providing us.
For sure.
But without further ado, Dr. Hilary Rutledge, tell us a little bit about yourself.
Thanks, you guys. Thanks for inviting me on. This is really fun. It's really cool to talk about what I do and what I love. So I practice functional medicine. That was not my first career. This is my second career. My first career was as a chiropractor.
Okay.
My initial thought was not that I was even going to be a chiropractor. I'm going to take you back down that road a little bit.
Yeah.
I'm from California. I was in nursing school. I already had a degree in public health, and I am the youngest of 5 kids. And my middle sister, who is also a nurse, who is my idol, was diagnosed with stomach cancer and died the year after I graduated with my public health degree.
Oh, my goodness.
And so that completely changed the trajectory of my life. And I dropped out of nursing school because medicine had failed her, and it had failed me, and it had failed my whole family. And so, I just didn't know what I was going to do at that point. I still had this wantingness to serve people. I still had this wantingness to really be in medicine. But I was pretty injured by having my sister die at a fairly young age. I was 23 when she died.
Oh yeah.
And it was pretty tough. And I had quit school and I had moved back home to help my parents, take care of her before she died. And I wandered around this world totally lost for about 3 years. As luck would have it, I actually got in 2 car accidents within 3 weeks of each other.
Oh my goodness.
Which I say is lucky.
Were they your fault is the question?
Neither.
Oh, okay. So that is luck. It was leading you down the right path.
Right.
Okay.
Absolutely. I don't think there's any accidents, not at this point in my life.
Right.
I don't know if I would have subscribed to that earlier in my life, but certainly now I don't think there's any accidents. So that landed me in a chiropractor's office. First time ever. Well, I had already done all the science that I would need for chiropractic school because I was in nursing school.
Yeah.
Right. So all of those prereqs are pretty much the same. There's one class I think I had to take, a physics class, and that was it that I had to take. But my chiropractor that I started seeing ended up writing me a letter of recommendation, and I started chiropractic school within a year of first becoming a chiropractic patient. So I did that. I graduated. I met my husband in chiropractic school.
Oh, nice.
It changed the trajectory of everything for me, of my whole life, for sure. So fast forward, we graduate 2000. June of 2000. I have a really long chiropractic career. I really enjoy it. I love helping people. I love the holistic piece of it. Mm-hmm. I knew I would never go back to mainstream medicine, not because it's awful, but because it didn't work for me. Mm-hmm. And I had too many bad feelings about it. So I moved forward and I was able to really pick up all of those things about my life and put them into chiropractic and into natural healing and into helping people in a way that worked really well for me. Mm-hmm. Another piece of that is that I also realized as a young person, and maybe my dad realized this well before I did, is that I don't take orders well at all, even a little bit. And so, there was a time where he had asked me my dad was very, very present in my life growing up as far as like guiding me and telling me I can do and be and have all the things I want if I work for it. Mm-hmm. Being the youngest of 5 kids, there was never enough money. There was always love. There was always unconditional love. There was always acceptance. There was always support. I got all those things whenever I got the lion's share of those things, being the youngest too. Yeah. That's for sure. So, as I was kind of figuring out, like, what am I going to be? How am I going to work that out? Before I even started chiropractic school, I ended up thinking, well, maybe I'll be an industrial hygienist. I can do chemistry. I can do like this kind of thing. Yeah. And my dad, in his wisdom, said, you want to work for Exxon or the government? And I was like, well, neither. He said, then you better start 10 years ahead and figure out where you want to be and let's work backwards.
Okay.
After I had my mind about me again, after I could start thinking about what I wanted to do. And then he said, why don't you just talk to Tom? Talk to him about being a chiropractor. You seem to like going there. And that's kind of how that happened. So about 15 years into my chiropractic career, I kind of got itchy. Mm-hmm. Like I could do more. I could do more. I could be more. I could serve in a different way. I always had an inkling, for natural health. I still had that piece of me that was like, oh, I was going to go to nursing school. I was going to be a little bit more mainstream in that way. But right around that time, I guess it was 2015, I started to look into different fellowship programs or diplomate programs. What could I add on to my degree? What else could I do to take it to the next level, to be more dynamic in my practice? And so that led me to a seminar, which at the time I didn't even realize was going to be part of a diplomate program, but it was. And I ended up earning a diplomate from the American Board of Chiropractic Internists over 2.5 years.
Oh, wow.
Took another national board. Woo! That's something you want to do twice in your life. I'll tell you that. And I was awarded that diplomate in 2018 and was practicing really chiropractic and functional medicine both for a period of time. And that was really hard. Yeah. As my dad would say, he's from Texas, it's hard to ride 2 horses with one ass.
Yes, true.
And so eventually I had to change and I had to pick. And I felt like I had given chiropractic a really good run. Right. And I had done very well and I was successful. And I felt like, okay, I need a new challenge. And so I hopped into it with a little bit of blind faith and the support of my husband for sure and my friends. And it was pretty scary. Yeah. But as soon as I dove in, the amount of people that showed up at my doorstep was shocking to me. Yeah. The amount was shocking. The people were amazing. The amount of people who need help, the amount of people who don't feel heard. I didn't realize we had such a huge need for that just here in Wilmington. Mm-hmm. This is a small place.
Right. It really is.
Right? I'm from California. This is a tiny place.
I was going to say, especially considering where you're from. Absolutely.
Right. I got my doctorate in the Bay Area. Like that's, this is a really small place considering that. So I had a lot of trepidation, but I just went for it. And I couldn't be happier. I can't tell you the amount of satisfaction I get from treating patients and from seeing people get better. And it's a completely different environment than chiropractic in that way. Not better or worse, just different. And I was really ready for a change.
Yeah, that's perfect. Just to go back a little bit. So how did you end up in Wilmington from California?
Oh, okay. Well, so my husband is a chiropractor as well. Mm-hmm. And so California is incredibly expensive. Have you guys been there?
Just once.
Okay.
For like all of 2 hours.
Okay. Well, it's my home still. Mm-hmm. I don't know if it'll ever not be my home. Right. I was born and raised there, but it is so expensive to work and to live and to own a business. So I guess it would have been different. We wouldn't necessarily have considered leaving if we weren't both self-employed.
Right. Yeah.
Right? Because when you're self-employed, that's a self-employment issue, right?
Exactly,
no one is actually saving for you except for you. And we have 2 kids, and we could have a standard of living and maintain that, or we could save for our kids and for ourselves. But it was really tough to do both when you're self-employed and have employees. California is a tough place to be an employer as well as be self-employed and be responsible for all of your people and your things. And we just thought we could do it easier somewhere else.
Yeah.
And it turns out that fate led us here. I never thought I would end up on the East Coast, let alone in the South.
Right. Very different, right?
Very different from everything I've ever known before I moved here. Yeah. And the other thing was we waited until after my dad died.
Okay.
I wasn't willing to leave.
Right. Makes sense.
That makes sense.
Yeah.
Totally semi on the path. What's a diplomate?
So it's an advanced degree. So my degree is a doctor of chiropractic. It's a DC. And so whenever you can have a fellowship, you can have a diplomate, it's just an advanced postdoctoral degree. So I already have a doctorate.
Okay.
So I don't know how they name these things. Tyler, do you know anything? I don't know anything about
that.
I've heard of fellowships because I've seen things on TV and I've talked to people who are like, oh, hey, I finished this and now I'm doing a fellowship. So I've heard of fellowship before. I'd never heard of diplomate. So
a fellowship, I think, is more almost like an internship fellowship, like that kind of thing, like at a postdoctoral level.
Right.
I think, I'm not an expert on that. A diplomate is actually just a whole nother level of degree.
Okay.
So sometimes you'll see people have one set of letters behind their name and then like 2 other sets of letters behind their name.
Right.
It's just an added set of letters behind the name.
Well, since we were talking about the difference between West Coast and East Coast, can you tell us the difference between more of a naturopathic medicine and Western medicine?
So naturopathic, so I'm not a naturopath. So.
Oh, okay.
Right. I'm a chiropractor. That's my base license. Isn't that interesting?
Yeah.
It is.
Right. So you can kind of go into functional medicine, whether you're a naturopath or you're a chiropractor or you're an MD or and you could be a pediatrician and go into functional medicine, or you could be an OBGYN and go into it, or you could be a nurse practitioner and go into it. You don't have to be any particular type of doctor to practice functional medicine. It all has to be within the guise of what your license allows in the state that you live or whatever states you are licensed in.
Can we start there first then? Because that'll help me a lot too. So what's the difference between functional medicine and naturopathic medicine?
Well, I'm not a naturopath again.
Right.
So I can't totally say that.
Right.
So, and I think a lot of it has to do with laws in states.
Okay.
In some states, naturopaths are allowed to order labs. In some states, they aren't allowed to order labs. So that would really impede their ability to practice functional medicine on any level if you can't order labs. Right. So I'm not super sure about that. Naturopaths, much like myself, I will say, don't use medications. They don't use pharmaceuticals, right? It is all nutraceutically based and diet and lifestyle. Okay. So it is very similar. Naturopathic medicine is very similar to functional medicine in that way.
Okay.
Yeah.
So functional medicine is different than Western medicine.
Yes.
Okay.
I'm going to tell you a little bit about that.
Oh, yeah. Please do.
Let's go into that.
Okay. So functional medicine is looking for a root cause. It's looking for a root cause. Like say, for example, Chris, you come to me and you have high blood pressure and you have psoriasis. Mm-hmm. And so we could just give you a blood pressure pill and we could give you some cream for your psoriasis, or we could actually investigate and see why you might have those 2 things. So I like to investigate. I like the puzzle. It's really fun for me to figure those things out.
Yeah.
And so I look to see, I look upstream and I say, hey, why does Chris have high blood pressure? Mm-hmm. What's going on in his life that's causing that? Is it something he's eating? Is it something he is experiencing at work? Is it his car is too small for him? Is it that he has unresolved trauma? Is it that he has a really tough experience every single morning on the way to work, driving through a neighborhood that triggers him for something? I don't know, right? Why does he have high blood pressure? Is he drinking electrolytes with too much salt in them? I don't know, right?
Yeah.
So we want to look at all of those things. And then with the psoriasis, same thing. Well, skin reactions typically have to do with your gut. They don't really necessarily have to do with your skin. And so the skin is where it comes out. The skin is your largest organ. So if you have psoriasis or psoriatic arthritis, which is also in the autoimmune family, then we're going to look all about autoimmunity, right? And we're going to check and see what's really going on with your gut. But I really tend to treat those things in a more holistic way. And there's a systemic approach that I use.
Mm-hmm.
And I would say that it is developed in the way that it is in order for me to get long-lasting, sustainable results with a patient instead of, here, just take this pill, and then we don't have to talk about it anymore. I'll see you next year.
Right.
It's very interesting because you're talking about looking upstream, which reminds me of what you said your dad said. It's like, hey, if you want to do this in life, all right, think 10 years ahead and then work your way back, which to me is like that kind of is a really good explanation of how you help people. It's like, so this is what you've seen as like an external factor. How do we get and fix that?
Mm-hmm.
Which is better than what I've heard explained by so many other people. It's
Thanks.
like, oh, hey, here's a pill. And I know almost every pill has a side effect. And you're like, well, this has another side effect. So you have to take more pills, which is so annoying, which is also why I don't take medicine.
Right.
Right. And I will say I'm not anti-medicine. I understand why we need it and when we need it. And, if you're going to have a root canal, that could be an infection in a tooth. That's really close to your brain. You might need to take a 4-day, 5-day antibiotic for that. I understand that. But I think that it is widely overused in today's system and not to our advantage any longer. As I was just reading last night, I don't know what website.
No, I don't know.
A news website about a new Shigella-resistant bacteria. So Shigella is a really infective gut agent. It's really infective, and they've just found a brand new antibiotic-resistant Shigella.
Wow.
That's not
You know what that means? That means that when MDs are checking for Shigella and they want to give antibiotics for it, that's not going to work.
Mm-hmm.
And that's going to land more people at my door.
Yeah.
Because it won't work, right?
Right.
So then we have to take a different approach. Yeah. So regarding functional medicine, it's based on biochemistry. It's actually based on biochemistry. And in my office, I have charts all over the walls to show people that. And I feel like sometimes when they come in and they see that, they're like, oh, okay, she knows what she's talking about. This is cool. We all learn biochemistry in school, right? But I don't follow the same protocols, that I would if I worked for a big conglomerate of medical doctors, right? Mm-hmm. So I can look at you, Chris, and say, oh, I think that you're going to need this type of test. Maybe you need this one for your hormones. Maybe you need this one for your gut. And you need this one for mitochondrial function because you're looking to perform at a higher level at CrossFit, right? Maybe that's what you need. And so then we run those tests. I take all of that information. I then layer it one on top of the other, create the sequencing that makes the most sense for what your goals are. Yours, not my goals, your goals, which is what I focus on as a doctor.
I like that.
Not what I think should be correct, but what you would like. How do you want to feel? Right? That's really important. It's important to not lose sight of that. And then we create a treatment plan that's going to get you there.
I like it. Seems a lot better and more functional, like you say, obviously.
I know, no pun intended.
I was going to say, look how it all comes together now.
And because my brain is super crazy, you say you have a bunch of charts around your office, so your office doesn't look like a typical doctor's office.
No.
No, I love that. I mean, you were saying that, and I looked up, and I'm like, yeah, our studio kind of looks like a doctor's office somewhat. Super white. Yeah, one side is like super, like plain white with a little bit of green. It's like,
And the other side looks like a studio.
Yes.
Yeah.
With all the liquor included. So my next question would be, what would the value be for someone that would come into your office that wouldn't necessarily have anything wrong with them now, but would want to, I guess, optimize their life? What kind of benefits, or what would you say to that type of client that would walk in?
I would say, thank God you're here because you're going to live for a really long time.
Yeah.
So that is interesting. And I'm going to get to that question. But one of the things that I do tell patients really frequently is that we are starting to outlive our organs, right? And so, and the easiest example of that is menopause, right? Women are outliving their ovaries by 30 years at this point, 30, 35 years. And so that didn't used to happen. And so, 250, 300 years ago, by the time you're 55, I mean, people are dying of infection. People are dying if they had a root canal. People are dying in childbirth. People are dying early on, right?
Okay.
It's not happening. And it's not because people are killing them. They're just dying.
Right.
The life expectancy wasn't what it is today. There was too much infection, disease, et cetera, right? So if you start go through menopause and your estrogen falls and you experience all these changes in life, in your ability to sleep, in your ability to be happy and have stable moods and not look like an old hag sitting on the front porch, right? Because when your estrogen leaves, then collagen changes in your skin and all these other things happen as well. Well, people really care about that now. People never used to care about that because you're basically just sitting around waiting to die, right? And so that's no longer the case. And our technology has brought us to a point where we are living well past what biologically, our biology will never catch up at this point. I can't imagine it will, not during my lifetime, not very likely during your lifetimes, where our biology will actually evolve to a place where it's going to catch up with technologically how long we're living.
Oh, wow. That's interesting.
So back to the biohacking, right? So your question was, if I don't really necessarily think I have anything wrong with me, but I'd like to optimize myself, how does my office serve you well? Well, what we do is we actually would look at several different panels. We would do a complete blood panel to actually make sure. And when I say a complete blood panel, I don't mean the kind that you would get run at your yearly physical, because that is not complete in my mind. That is a snapshot.
Yeah.
Okay.
That is a snapshot. That is not even close to what I look at for what I call a super panel.
Right.
I just supersize it. That's how I got that. I supersize it.
That's great.
I like it.
So we would definitely run that because we're checking for a lot of biomarkers that you have no idea how that might be affecting you or not affecting you, because people never look at them. You would never, and I hear it all day, every day. I've never had that checked before. I've never had that checked before. Why did you check that? Right? I would also look then at your adrenal glands, your cortisol output, and see about your ability to handle stress.
Okay.
A person's ability to handle stress is their number one biomarker for how well they are going to age and how well they're going to handle aging.
Oh, wow.
How do you handle stress? How do you recover from stress? Are you in a constant state of cortisol heightened in your body? That's going to be tough. That's going to lead to weight gain. That's going to lead to brain fog. That's going to lead to being diagnosed with things like fibromyalgia, and that type of stuff, right? So if you can't handle your stress right, we start there.
Okay.
Then we go to the gut and we see if you have any infections. Even if your gut doesn't feel bad, some people don't have any gut symptoms at all, but have panic attacks. Well, that's probably starting in your gut.
Yeah.
Wow.
So then we go to the gut. That's the second place that we stop on our tour. And we handle that. If you have infections, we fix the infections. If you don't, then we just optimize your gut.
Yeah.
Yeah. Everyone should have a certain amount of good bacteria. You need a certain amount of different enzymes and steatocrit and different things to be coming out in a stool sample that would say that you're really, really doing well, that you're digesting, absorbing, and assimilating your food in the best manner possible. The liver's doing the job, the small intestine, the large intestine. You have a lot of pieces in here that nobody ever thinks about that are constantly working on your behalf, right?
Yeah.
And then we go to organic acids, which is the most exciting part because that's where we get to look at the cells and how they're actually operating, how they're talking to each other, and if your mitochondria are working properly.
Oh, wow.
Yeah. And when you're talking about longevity, you're talking about mitochondria. That's it. Mitochondria has to do with almost every disease process, just like inflammation does, because inflammation is going to happen when mitochondria shut down.
Okay.
Learn something new.
Yeah, that's interesting.
Yeah, not to get too sciencey on you guys, but I thought That was pretty good.
Yeah, that was great. That was just enough. That was,
Okay, good. I don't want to go any further if it's too
I'm
much.
weird. I liked science in school. Like, I loved biology. My teacher hated me because I never did homework, but I'm like, I just absorbed all of it. I'm like, this is super cool. And then I got to college and I'm like, yeah, this is too much, but that's a whole nother story. Second question, or I guess first question, what is cortisol? Because I've been seeing this lately, and this could just, like you said, there aren't any accidents, but it just started popping up and people are like, oh, you have high cortisol levels or this. And I'm like, I've heard the word before, have zero idea what it is or what it affects, I guess.
Okay. So cortisol is a hormone.
Okay.
And we have a lot of hormones.
Yes.
Cortisol is the stress hormone. Cortisol lives and is excreted from your adrenal glands. Your adrenal glands sit on top of your kidneys, and cortisol naturally raises when you wake up in the morning. It's called a cortisol awakening response. You wake up and your body goes, okay, time to get up. And then it comes back down again, and then it goes throughout the day, and it kind of, ebbs and flows depending on what happens in your day. You're going to have a cortisol spike if you are driving to work and you see a car accident in front of you. Your cortisol is going to spike. And you're going to feel like the adrenaline, and you're going to, maybe you start sweating, or maybe you're like something like that. You'll feel the cortisol spike. That's completely normal, but it has to come back down again. So a lot of people can't make it come back down again. A lot of people have lost their ability to self-regulate their cortisol. So that's really damaging, because then you get stuck in fight or flight. Mm-hmm. And so here's something that people will say to me, a lot of patients will say to me as they are looking at their cortisol test, and it's off the track. It's literally off the scale. And they say, but I don't feel stressed. That's because they've been this stressed for so long that they don't know what normal feels like anymore.
Wow.
And let me give you an example of that. So we live in a pretty fast-paced culture and society, especially, and I have a lot of women patients who fit this particular description that I'm going to say. And so you are working as a teenager to get to where you want to be, right? To get to where you want to be. So you start grinding pretty hard somewhere in high school, whether you're doing sports or grades or a combination of both, or extracurricular activities. Right. You start grinding pretty hard. All of a sudden, you're not getting the sleep you need. You're an adolescent. Your brain, nor your body, nor your hormones are fully formed at that time, but you're grinding already. But and this is where we live. This is I'm not blaming anyone. I'm saying this is what happens.
Yeah.
So then you get to college and you're like, well, hard work is what got me here. And so I just have to keep grinding. I know how to do this. I'm a grinder, right? You'll hear people say it. Yeah. I'm a grinder. That's how I get it done. I'm a grinder. I don't really prepare. I wait till the very end. I'm a procrastinator. And then I just do it. That's a huge cortisol spike right there. Mm-hmm. Well, then they just train their bodies to function that way. They train their bodies to not work in any other way. And so, especially I find for women in our culture, right around age 38 to 45, they crash. They crash. And here's kind of the pattern that happens is they started grinding early. Many have eating disorders of some sort, or disordered eating. It doesn't have to be an eating disorder.
Okay.
But Cosmo says we're supposed to look a certain way. And as an adolescent female in our culture, I don't know anyone who hasn't ever felt something from that. So that comes into play. Were they starving themselves during high school? Were they taking diet pills during college? Were they doing speed all night? Mm-hmm. I don't know. Maybe all of those things, right?
Right.
And then you're working forward. Your body's resilient, right? But it all takes a toll. Most of them are also on birth control at some point, which is a whole nother plethora of weeds to get into, right? And so they get to this point where they are so exhausted and they're so burnt out and they don't understand why other people can function and they can't do it. They can't even make it through the day without feeling complete fatigue. And they start going to the doctor and asking for help. What's wrong? They've run all the tests. That's what I hear all the time. They've already run all the tests. They don't know what's wrong. No one knows what's wrong. They've run everything. Okay. Right? They've never run a cortisol test. Salivary cortisol is the best way to run your cortisol because it actually gets what's really happening as opposed to blood cortisol. It's a little bit of a different, you can get cortisol in urine, blood, or saliva. Saliva is the best way to get it. And so these women are exhausted, they're fatigued, and now they're full of self-loathing because they don't understand why this is happening to them. No one told them this was going to happen. They just said, keep working, keep grinding. You get married, then you have kids. Don't have one kid, have two kids. Have two, or, oh, I guess we're going to have three. Okay, well, here we go, right? And you worked really hard for a career, and then you put that career on hold, and no one ever asks you how you feel about that because now you have kids, which is supposed to trump everything else. Maybe it does. Maybe it doesn't. I don't know. That's literally a patient who walks into my office 5 days a week.
Wow.
I'm not even surprised.
Yeah.
Just think about our culture and how it works.
Yeah.
And then layer the hormone part on that. They're just exhausted from the cortisol piece of it, right?
Yeah.
It's the up and down and up and down. You have to grind pretty hard to be successful at 29 in Washington, D.C. or Atlanta or New York City or San Francisco, right? To be able to live independently, pay your own bills, all of those things. You've been grinding for a while if you're at that level.
Yeah.
And then you're like, oh my gosh, now I've got these kids and I'm chasing them around and I can run board meetings, but I cannot handle this, right? Because you didn't train yourself for that. You trained yourself for the other. And then you just assumed that parenthood would be easy because people say that that's what you should do.
That's a good point.
Right?
Yeah.
I don't know if it's easy. I don't know if being a parent was easy. It's the best job.
Yeah.
I wouldn't say it's the easiest.
Very true.
Right? So they come in and their cortisol is whacked. And you know what they say? I don't feel stressed. And that's the person I've just described to you is who says, I don't feel stressed.
You've been doing this the whole time.
Their
Right.
baseline is so much higher.
Right. They've been doing it since they're 15. So they have no idea what that feels like. They don't know what it feels like to not be stressed. And this is a person, here's another thing that I want to add into that piece of cortisol. The person I described comes from a very solid foundation like myself. My parents were married until they died. I never had a broken home. I never wondered if I was going to have food on the table the next day. I never wondered if my dad was coming home at night. That never happened to me, right? I can think of 10 people that I know that did happen to who are my age. And the younger generation has a whole lot more than that than I do, right? When you don't have safety and security in your childhood, your cortisol is flipping out by the time you're 7.
Oh, wow.
You hear keys jingle, you hear a door, it's cortisol spike. Is he home? Is he alone? What does that mean, right? To a kid. And so you can start with this type of dysfunction really early on. And that is something that a lot of people don't realize, and they don't know why they're like that. And I'm not a mental health practitioner. I'm talking about biochemistry. Most of these people also need help through therapy of some sort, whether it's talk therapy or EMDR or group or, there's so many great options out there right now with mental health. And I recommend any and all of them because this life is not easy and we make it harder in our particular culture. We don't ever give time.
No.
We don't give time. And let me just go back to that scenario after my sister died. I took time.
Good.
I took 3 years. It was 3 years before I started chiropractic school after my sister died. I was broken.
Yeah.
I was broken and I was wandering around this world working. I mean, I was living.
Of course, yeah.
I had friends. I was going bowling. I was going snowboarding. I was doing things. But I didn't have any purpose, right? But I took time. I was also, as my dad would tell me later, young enough to make some mistakes after that happened. He said it hit us all really hard, but you were young enough that you weren't already on your path and you could change it.
Yeah.
You had the opportunity to change it. Not everyone does.
Yeah, that's true.
Right? If you were afforded more time to grieve for your husband who was killed in Iraq, for example, maybe you wouldn't have to have such high cortisol.
Yeah.
Right? If you were given a better opportunity to, there's just so many opportunities that there are for healing that would help physiologically, long-term, our entire population that are not talked about. Meditation, daily exercise. How about getting enough sleep?
Yeah.
How about getting enough sleep? I'm like a princess when it comes to my sleep. My whole family is doing something and I'm like, my phone goes black and white 15 minutes before my bedtime and I'm like, oh, I'm out.
Yeah.
That's it. I just close my door. I'll put in earplugs if I have to. It's over.
Yeah.
That's cool.
That was one of the things that I started focusing on a couple of years ago too, was the sleep aspect of it. And I wake up early too, but I also go to sleep early as well to get it in. Because I just know there's a huge difference, especially when I started working out and doing MMA and stuff too. I knew when I got at least that like 6.5, 7 hours of sleep, that I was able to push more weight. I was able to just get through life a little bit easier that way.
I mean, there is
Tyler, 6.5 hours of sleep is not enough. That's not enough.
It felt like enough.
It felt like enough maybe because it was more.
Yes.
Right. Yeah, it was more.
I mean, but
what
there's
is
still
the perfect amount of sleep then?
I'm
Go
so-
ahead.
okay. So sleep cycles actually run in 90-minute cycles.
Okay.
So you're going to want to get, in order to not interrupt a sleep cycle in the middle, because that's kind of when you wake up and feel really groggy, right? Even if you're like, God, maybe I got too much sleep. Do you hear people say that?
Right.
Mhm.
So you would go for 6, you would go for 7.5, or you would go for 9.
Ah, gotcha. Okay.
My minimum is 7.5.
Good to know.
I was going to point out there's a difference between sleep and rest, because I will fall asleep sitting on the couch with my wife, and she'll be like, how did you fall asleep? I'm like, I just do. Then I'll get up and I can do the dishes, go lay down and pass out before her. But then showing up today, I still have bags under my eyes and I look and then so tired, and I still got 6 hours of sleep. Like I always get a minimum of 6.
Chris, 6 hours. That's not enough sleep.
You said hour and a half increments. So
I did.
6, 7.5.
But 6 is really not enough. Do you get 6 on a regular basis?
Yeah.
I'm going to suggest 7.5.
See, there's your challenge now, because Chris always likes to dish out challenges. So he has a new challenge now.
Fun. Let's talk about nutrition.
We have gotten a lot better.
Okay.
So everyone, I definitely suggest doing research, finding a doctor or someone who can help you learn more about yourself, because not everybody, I consider myself a pretty intelligent person and can read my body not as well as a doctor can. But I know I was being stupid for years. I was like, pizza, lasagna. Like I knew I was eating stuff that was horrible for my body and my body was reacting. And just being intelligent enough, I was like, we should probably, my wife wanted to be better and eat healthier. So we changed our diet. So initially it was for us to lose weight. And in that process, we were like, let's find foods that react better for us. And so we changed a lot of we cut out cheese almost completely. And my body was like, oh, you feel so much better. And I know that cheese is not good for you. It tastes so good. So does ranch. Like I love some ranch, but I understand I cannot eat that every meal.
So to play off that a little bit too. So full disclosure, you know my mom pretty well.
I do. I do.
And one of the things my mom has always said is your gut is your second brain.
Yeah.
Can you go into that a little bit more too, and why it makes such a big difference of what you're eating and how it plays into basically being your second brain?
Sure. So just starting with basic nutrition,
Yes.
right? The standard American diet is atrocious and pitiful. You know, there's nothing good for us in Cheetos or
Right.
Doritos. If it has an O's on the end, just don't eat it, really.
It doesn't.
SpaghettiOs,
It has
anything
an
with an
S
O's.
at the end of Doritos.
Well, OS. O's.
Yeah.
I was
You're trying to find a loophole.
I know. That's fun. No loopholes here. So it does really start with nutrition. And there's a great book called The Blue Zones. I don't know if you guys have heard about that book, but these are areas of the world where people on a regular basis live to be over 100. And it looks not only at their daily activities and stress level, going back to your cortisol, but to your point, Tyler, what are they eating?
Yeah.
They're eating food that they grow in almost every single case, grow or catch. One of them was Okinawa.
Yeah.
And then there was one, I believe it was in Sardinia, in Sicily. Anyway, so the gut, boy, it's a big thing. So if you're eating good food, say you're eating grass-fed, organic vegetables, very little processed carbs, anything that's processed, right, doesn't grow that way. So that means basically everything that comes in a box or a wrapper like that, right? So if you're eating very little of that, like maybe 10% of your diet is only that, and the rest of it, you're eating really regeneratively grown animals and fruits and vegetables, you're probably going to have a pretty good microbiome. Okay. Microbiome meaning the mucosa in your large intestine. That mucosa is responsible for a lot of things. It's responsible for your immune system.
Mm-hmm.
It's responsible for it's responsible for how you feel. It's responsible for your neurotransmitters making it to your brain in time to determine how you want to respond to a situation, or are you going to react to the situation? Can you take the time to do it the right way, the way that you want to show up, or does something else show up instead? Right? All of that happens inside of the gut. So if you don't have all of the right precursors in the gut, all of the right nutrients, and so that comes from like fiber breakdown, for example. You have to have enough fiber in your diet. Well, fiber is one of the things that a lot of Americans don't have much of in their diet. You know, for whatever reason, they think fiber's bad, or they read something about it, or there's a different diet that they're doing this week or this month or something that has to do with that. And there's so much opportunity for that because I think that space is so full, right? The space is so full of different information of hacking this or a quick fix for that or something like that. There's just no quick fix. Your microbiome started when you were little. It starts with nursing. If you weren't nursed as a baby, then you didn't get exactly what you needed from the get-go. It actually starts with birth. If you were C-section versus born vaginally, you didn't get exactly what you needed from the microbiome of your mother through the vagina when you were being born, which is actually inoculating you with the correct starting for your microbiome.
Oh, wow.
Right. So a lot of people aren't born that way.
No.
A lot of people aren't nursed.
Right.
A lot of people are given formula, right? So they're starting behind the 8 ball. And then if you think about the amount of antibiotics that kids have, that just destroys your microbiome. And sometimes they're necessary. And maybe not all the time. Maybe they're given too often, but sometimes they're really necessary. I had pneumonia as a 4-year-old. I needed some antibiotics, right? I don't think I had them again till I was like 12, but when I was 4 and had pneumonia, I needed those antibiotics, right?
Sure.
Well, that wrecks your gut as a 4-year-old. So you have all of these things that are happening. And then you have like pudding at school. Do you want to talk about school lunches at all? We shouldn't.
Oh, yeah.
It's not good.
No.
Well, it's industrialized food. I don't know how much different it is than what they get served in prison.
Yeah.
Right.
I mean, you could maybe do a show about that. I'm not sure. But
yeah, that Aramark truck shows up at the school and the prison. So,
right? I'm not kidding. I mean, it's really bad what they're served at school, and I don't know anyway. It's not helping any behavioral issues at school. It's not helping anyone pay attention, certainly. And how much of it is actually nutritious food, right?
Right.
So when you go back to what you should be eating versus what we're being fed as children, that's where it starts, right? And then kids have stomach aches. Kids have some sort of problem, going to the bathroom, say something like that. They're just told to eat dates,
Yeah.
right?
Oh, gosh.
Just eat dates or prunes, right? Something like that. Well, chances are that they have some real other things happening already. And I've got a lot of kids, and I've got a lot of patients actually who started their digestive problems as kids.
Wow.
I will say a Southernism for me, when I moved to the South, I had never met so many people who did not poop on a regular basis.
Really?
So
wait, that's just a Southern thing?
interesting. Well, I did not have that on the West Coast. We tend to eat a little bit more, we eat a lot of greens. We eat a lot of fruit and vegetables.
Okay.
In California in particular, I can't speak for the whole West Coast, but the diet tends to be a little bit cleaner in that way.
Right.
We don't have, for example, not being Southern, I don't eat fried chicken. I don't eat biscuits. I don't eat that stuff. I don't even crave it.
Have you had it before, though?
Oh, I have had a biscuit.
Okay.
I don't know if I've had fried chicken, like an actual, something that someone would be proud to say, I've made this fried chicken, but I don't ever crave that. So the diet does have something to do with it. Biscuits and fried chicken are going to make you constipated, right?
Makes sense. Yeah.
Yeah. It's not good for you in any way. It's a lot of oil and it's a lot of dough. Well, that's just going to block up your sink, let alone your colon.
That's a very good point.
Right? So what you eat really matters in that way. And then you take into it the antibiotic effect that almost everyone, probably the 3 of us in this room, have had at some point in our lives. If you're not re-inoculating your gut after you have antibiotics, then it doesn't just necessarily regrow them all on its own when it is not given the proper building blocks in the food. So if you are eating that grass-fed, regeneratively raised and grown animals and plants, your body can actually recover pretty well, right? That's not what we Americans eat, not in our culture of fast, 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 fast. You got to get there. You got to make it. You got to get to the next level. You got to get the raise. You got to get the promotion. When are you going to have the baby?
Mm-hmm.
Then you're so stressed out you can't have a baby.
Yeah.
But no one feels stressed.
Right.
Right? So with the gut, when you have long-term dysfunction in your gut, you are going to have issues with brain fog. You're going to have issues with cramping. You're going to have issues with elimination. You're going to have toxicity build up inside of your body that causes systemic inflammation. Inflammation is the root of all disease. Right. So if you can't eliminate properly and you can't get the things going on in your gut, like there's a whole living microbiome in there, and they're communicating and they're talking and they're pulling the strings on your puppet show, right? So think about it like that. And if you've got 4 days worth of excrement built up on your puppet show, how do you think you're going to feel? How do you think you're going to show up that day?
Yeah.
Nothing's going to go well. And by the time I see patients, maybe they've been constipated for 10 years.
Jeez.
They have constant headaches. They have allergies to everything. They can't open the windows in their house. The pollen kills them. Wow. I can stand in the middle of the pollen cloud. I'm good.
That's crazy. I didn't realize there was so much that was connected through that.
Oh, yeah. And this is just a smattering.
Right.
Right. Mm-hmm.
So I guess my next question for you, with that being said then, is for Chris and I, just not knowing what we don't know, so we can't ask the right question. What's something else that, because I know you came very prepared too, so what's one of those things that you have there that you would want the majority of our listeners to know? So most of our listeners too are going to be a younger professional that is doing exactly what you said, right? That's grinding. Yeah. So what's the one thing that you would tell them that they could do other than showing up on your doorstep, right? Because I'm sure that would help a lot. What's something they could do now?
Sure. And I just want to go back to the grinding. I resemble that remark. I didn't get to where I am with all the degrees on my wall and all the years of school without grinding.
Absolutely.
I got it. I get it, which is why I see it now. And I'm like, okay, you're going to have to, it's okay if it takes another 2 years. Mm-hmm. You can still get there. You don't have to do it by June. I promise. Right. The goal will still be there. I think that is one thing that is lost a little bit on the younger generation in that way, is that you can do it. It was certainly lost on my generation. No one ever told me, maybe you should slow down. Right. Oh, no. Once I actually got moving, once I actually got the fire under me, I wasn't slowing down. I don't think I would have listened anyway. Right. I'm not always open to suggestions, right? So I would say there's a couple things. One, functional medicine is very low risk. Interventions around food and lifestyle, cellular repair, you're not going to hurt anybody doing that.
Right.
Right? Nutrition, there's 2 things that I want to say about that. One, most of our food is contaminated, and don't practice nutrition by comparison. I call that death by comparison. Mm-hmm. I eat better than Chris. I'm fine.
Yeah.
Right? That's what I hear. I eat better than most of my friends. I eat better than everyone I know. It doesn't mean you eat the way that you need to eat.
Exactly.
It doesn't mean you eat the way that your biochemistry needs. It doesn't mean that you're doing what you need just because it's better than what other people, just because he's eating at Doritos and Bojangles and I don't know, what's the other? Chick-fil-A. Chick-fil-A.
I can't eat Chick-fil-A.
I've never been to Chick-fil-A.
I mean, it's okay, like every once in a while, but like I've had it, and my body was like, and
not the best.
And at least I understand. I'm like, no, don't eat that anymore.
I'm so glad you're listening.
Yeah.
So many people don't listen.
Oh, it only took me 32 years.
You know what? Some people don't listen.
Yeah.
Doesn't matter how old they are. They never hear it. They're never going to hear it. So nutrition, death by comparison, is the worst thing you can do. If you know you shouldn't eat something, just actually don't eat it. Don't say, well, I deserve it. I work so hard. It's a special occasion. I'll poison myself. Mm-hmm. That's what you're doing when you're eating that cake or the cookie or the whatever it happens to be, right? Yeah. I think the next thing is that.
So question
Yeah.
on that, because you were talking about nutrition and treating yourself, because everyone wants to do that.
Oh, to treat yourself?
Yes.
Yeah.
Treat yourself.
Oh.
Nutritional wise, what would you suggest as like a treat, especially if someone's like mind has already been, we'll say, conditioned to be like, oh, hey, you should get a dessert of a cookie or a brownie or ice cream. What do you suggest would be like a better alternative?
Well, it always depends on the individual.
Okay.
Because some people can have dairy, not that many, but some people can have dairy and be fine. So I can tell you what we have in my house. In my house, we have dark chocolate covered almonds. Mm-hmm. We have dark chocolate bars. And if we have ice cream, it's made of cashew milk.
Okay.
That's what works for us.
Yeah.
That's good.
I mean, it's better than me just going out and buying like Ben and Jerry's. And like
well, right, because they have the cat. Yeah, I mean, in my former life, I love me some Ben and Jerry's. Yeah.
I love that. Sorry, I was just distracted. I was like, how would you treat yourself?
Yeah.
Because I hit that point. I was like, ooh, I lost like 8 pounds. Let me treat. And they're like,
I'm undoing my work.
Yeah.
Right.
Yeah. Also, smoothies are a great way to do it because you can get so much great stuff. So I always put really fat stuff in a smoothie. I put coconut milk in smoothies. I put almond milk in smoothies. I put cacao chips, blueberries, bananas. But when you're putting coconut milk in there, and I put in some collagen, and I put in some protein powder, but it is so delicious. And you can make like a peanut butter cacao, like cocoa powder smoothie. And it's like,
does sound
it's
good.
like a Reese's.
Yeah.
So there are smarter ways to do it.
Yeah.
Right. And you can make like really delicious, creamy, like with coconut milk yogurt. I make that. I don't have dairy. So when I'm saying coconut, I don't drink any
replacement.
Yeah. I don't drink any dairy. Or you know what happens to me, Chris? I get eczema all over my legs because my microbiome says, what? No, thank you.
Yeah.
Not interested.
Yeah.
No, thank you.
Sorry. That was just like, if I didn't ask that, my brain would have forgot all about it.
No, it's good. Yeah. It's good. And if you're not a chocolate person, then I suggest baked fruit. Like I love to make like a apple crisp or a blueberry crisp, something like that with like a gluten-free topping.
Interesting.
Yeah.
Good.
Baked fruit is a really great way to get like a sugary type of sensation.
Yum.
Yeah. To the question.
Yeah.
I think that back to Tyler's question, I think, what can people do? So I think that there's a couple different things. Educating yourself is really good. It can get a little bit sketchy because what I experience is people who have researched and researched and researched and researched, and then they've tried all of these things and then nothing's worked. So now they believe that they're not going to work at all. But ultimately, oftentimes people do them in the wrong order. And so that can be really frustrating. And there's kind of a top 10 things that people will do in functional medicine that they'll try for themselves. They're going to take more vitamin D. They're going to take a probiotic. They're going to stop eating gluten and or dairy, depending.
Right.
One or the other, or one then the other, or they'll quit one and then start the other one, or however they want to do. They'll get more sleep. They will exercise, and they'll try to cut out sugar. But then they don't know that carbohydrates count as sugar.
Yeah.
So, or they cut out all carbs, and then they are not having enough fiber in their diet because they're also not eating vegetables or fruits. Right. So then you end up in a real sticky wicket because people will research themselves into a hole.
Yeah.
And so there's no balance in that. And that becomes dangerous. That becomes like eating a really, really limited diet for a longer period of time than is therapeutic, which is typically no more than 3 months, is considered disordered eating.
Okay.
And so you have to be careful about that.
Yeah.
Because your body needs what it needs, regardless of whether your mind tells it that, right? Or what the research says. And people who are just researching on their own don't know what their body needs because they haven't run any tests. And everything should be based on individual biomarkers.
Right.
Individual biomarkers. So someone said to me when I was kind of thinking about this, I think it was my sister, she said, well, what are you going to talk about? You don't have a way that you treat all the people. Like you don't have a way that everyone gets treated. I said, that's the whole point.
Exactly.
Yeah.
That's actually my whole point, is that everything's based on individual biomarkers. A lot of the testing is the same. Pretty much everyone I see is going to have a cortisol test. Because if you can't handle your stress right, your physiology can't function properly, right?
Yeah.
But there's different reasons for that. So we have to walk down that path. So I think that educating yourself, but not over-educating and not going too far off the deep end is kind of a cautionary tale in this, because there's a lot of information out there in that sphere right now as far as self-help, how to hack your health, how to make it better, how to perform better, how to think better, how to sleep better, how to do all of those things. And some of them might work for an individual without getting any information. Some might not.
Yeah.
I'm not sure. There's a difference between optimal and normal. And I just think that that's a really important thing to consider. What's normal? What's common versus normal? What's accepted versus normal versus common? And optimal sits at the top.
Yeah.
So then you have to kind of figure out where you want to be in that.
That reminds me of something else my mom has always mentioned too, is the blood work that's typically done at a normal doctor's office is very limited. And what you all look at is beyond the scope of what they consider normal, which the normal range is based off of a bunch of sick people, right?
Yeah.
So I guess, can you describe that a little bit better than what I did?
Yeah. So when we order labs, when we order blood labs, we get the results back and we do a much larger panel, like we talked about a little earlier. And then the other thing is our ranges in functional medicine are optimal. They're not standard. So for example, an insulin range. So MDs in most cases, primary cares don't run insulin. They will run glucose. They'll run hemoglobin A1C, but they don't run fasting insulin. I always run fasting insulin because I want to see what your insulin is doing. Are you recovering after you eat? Yes or no? That's really important, right? Or do you have insulin swimming around in your veins causing insulin resistance, causing fatty liver, causing metabolic syndrome, all those things that are going to walk down to chronic disease processes. So insulin for the standard range is from 2 to 19.
That's a big
My
range.
range is 2 to 5.
Oh, wow. Yeah.
It's 2 to 5.
That makes more sense.
Yeah. And so if you have insulin of 12 and a half, well, one thing is if an MD ran that, right? If an allopathic doctor ran that and saw it was 12 and a half, they might say, oh, okay, well, you need to cut down on your sugars, et cetera, whatever that is, whatever their advice is. Yeah. And it's probably very accurate, but not necessarily is there ever any follow through done.
Sure.
Right? Because you don't see them again for a year, right? Or maybe 6 months if this is a diabetic patient, and they just let them go. But at 12 and a half, I'm going to be like, hold on, stop everything. We can't do anything till your insulin's under control.
Right.
This is code red. We got blinking lights going on right here. So again, that comes kind of into the order of operations, which is why the blood labs, along with the other functional tests, I kind of look at all the things and determine what's the most important. Because there are certain things that are like gatekeepers in your body. And if you have one of those gatekeepers is closed, you're not going to make any progress. And I think that I don't know if you guys have heard this. I hear it all the time based on what I do. I'm doing the same thing I've always done and I keep gaining weight.
I mean, that makes sense because if you're doing the same thing and the gate's closed, then you're like, well, it's not.
Right.
You haven't opened up a path to actually get to that point.
Right. Or I've never had a problem with this before, or everything changed after my second kid, or everything changed after my third kid. I had that third kid and everything fell apart. Well, it's almost like there's a circuit breaker in your body and it's like, bang, it just got flicked, and we have to figure out how to actually turn it back on again. And there's no telling what gate that is. So you have hormonal gates, you have metabolic gates, you have gastrointestinal gates, right? You have all of them in that way. And there's no way to tell exactly which one it is without the correct data. Yeah.
You, in your blood work, ask the right questions. Because like Tyler said, we don't know, like a normal person doesn't know the right questions to ask, or I would assume like most allopathic doctors are going to be like, okay, well, we're only asking these questions, but you open it up and you go optimal and you ask more questions to find the answers that can get you to the next step.
Yeah, I just like to look at the whole picture more so. And that's just not the way that the allopathic system is set up. It's just not set up that way. It's set up to be very cookie cutter, and very mechanistic, so that they are doing really like cursory information at a general practitioner. And if there's anything outside of that, you go to a specialist, right? And then you go somewhere else, or you go somewhere else, or you go somewhere else. Or even I've had several patients recently who feel like they need to see rheumatology, but because their rheumatology numbers are negative, Rheumatologists won't see them.
Oh, wow.
Right? And so this is a system.
Yeah.
It's not based on what people need or what people want or what people are asking for. It's a system that's set up for management of a population. It's population management, right? It's not really helping people be well.
Mm-hmm.
And medication, one after the other, after the other, after the other, built one on top of the other, on top of the other, on top of the other by a different doctor every single time in that Venn diagram is making people sicker, because then you end up just being like a petri dish with all these things thrown in, and they're like, okay, good luck.
Yeah.
Right.
Does that make sense?
Oh, for sure.
Yeah.
Yeah.
And
It's pretty cool.
Oh, I love that.
so kind of what you were describing with the system, like that's kind of what people talk about when everyone's always saying the system's broken, right? It's
Yeah.
kind of what you're talking about when they're talking about just throwing stuff together and saying like, well, hopefully that works now.
Right. Right. And I think there are really good parts to the system. You know, if your appendix bursts, you're going to go, right? I'm going to go. You need to take me. If I get stabbed, I definitely need to go.
Yeah.
I'm pretty risk averse, so I don't think I'm going to get stabbed. But if I do, I'm going to need to go to the ER, right?
Exactly.
There are definitely parts of that system that work and that work really well. Emergency medicine, I think, is an exemplary piece of that for sure. For sure. It's the people are aging and people are sick and they are eating sick food and they are practicing sick habits. They're not going outside. They're not getting outside. They're not actively involved in things that are important to them or give them purpose, especially after a certain point in life, and they start to decline. And unfortunately, the allopathic answer to that is just giving them medication.
Yeah.
Just one after the other. And these are very highly educated, well-meaning people, but that's the system within which they work.
Yeah.
Right. And they were also educated 8 years, the exact same or over more than 8 years in that one way of only doing it. So
Right.
they don't know any better.
Right, right, right. Although functional medicine has a lot of medical doctors who say flat out, I just see my patients getting sicker and sicker and sicker, and I had to stop.
Yeah.
I had to do it a different way. And you can't make everyone well. Not everyone wants to be well.
Right.
I mean, some people come to me and they just want me to fix them. Well, that's not how it works in functional medicine. It's really teamwork oriented.
Yeah.
They really have to do the work. I just tell them how they can be and reach and have the things that they want to if they really want it.
Mm-hmm.
Right?
Yeah.
Yeah.
Which leads to my question. What would you describe as like success with a patient?
So on a follow-up visit, I have a list of questions that I ask them, and it starts with, based on your initial complaints, I'd like you to tell me which ones are better. And if you can give me on a scale of 1 to 10, that would be helpful. If you can't, that's fine. And I just asked a woman this past week, so the same question, right? She said, everything's better. Every single thing is better. I can't believe it took me so long to find you. I'm so pissed about it. That's pretty successful right there.
I'd say
Oh,
so.
for sure.
And she's not done. Everything's better. Or another way that I can gauge success is someone where they've gone through a treatment protocol with me and I've said, okay, you're good. You're on maintenance. And then in 6 months, 4 months, whatever, they call me back and they say, I have something going on. So I think that that's the other thing that is really rewarding for me is building relationships with people. And I did that a ton as a chiropractor. But with chiropractic, you see people much more frequently,
Right.
you know?
Oh, for sure.
But now it's a little bit harder to build long-term relationships because I don't necessarily see people as often. But when I get these same patients coming back or then bringing in their kids or then bringing in their husband or their mom or referring people and creating that network of sustainability and like-mindedness, it's really, that just makes me know that I'm doing really good work. So that makes me feel like I'm being successful with patients as well.
Yeah.
Because if you actually think that I did a good enough job with you that you're going to send me your mom, there's not much higher praise than that.
Right.
No.
People will bring you your kids before they bring you your mom.
That's interesting.
Mm-hmm.
That's
I will
funny.
say the look on your face when I asked that question, like she truly like means this. Like her finding success is just like her face lit up. Like she has been smiling all day. And I asked that question. She's like, it was just heartwarming, I guess.
Yeah, it feels really good to help people be better, especially because a lot of my patients come in and they say, I've had all the tests run. I've been to all the doctors. I don't know what I think this. I've been exposed to this. I might have Lyme. I worked in a moldy office. And they have a litany of things. Mm-hmm. And I say, okay. And they're like, oh, really? You're going to listen to what I had to say about that? Right?
Yeah.
My initial visit is 75 minutes.
Oh, wow.
75. Your initial visit with even a specialist isn't going to run you more than 10 or 15.
No, not at all.
Right? 75 minutes I sit there and listen to them and I let them tell me their story. There's a lot of information in that story if you listen to it. Mm-hmm. I pick up a lot of different things and I ask very specific questions on their paperwork, all about their history as well, which is going to give me information about their cortisol, right, about their stress, about their family environment, about their support, about their job, about all the things that are going to make a difference in how well and how quickly they're going to get there.
We ran up on an hour pretty quick here. So that's always good when we get surprised about the timing. But we do have one last question for you. And that question is, if you could tell your younger self one thing, what would it be?
Wow. Slow down.
Yeah. Brings it all together.
Slow down. You're going to get there anyway.
That's true.
Slow down.
Yeah. I think that's very important for a lot of the listeners that we have on too.
Oh, for sure.
Mm-hmm.
Yeah, thank you.
Sure. My pleasure. This has been really fun.
Yeah, I feel like I was meant to hear that. Like this past, since we started the year, we've had a lot of people on, and a lot of them have been like, I needed to hear that. So it's been interesting. I like to, I'm always rushing. And everyone's like, oh, where you go next? You want to do this? And I'm like, it's time to slow down a little bit, rest, reset, then go for it.
If you're in it for the long game, that's the way to get there.
Yeah.
Yeah.
And we're going to live a long time.
Mm-hmm.
Our life expectancy keeps increasing.
Yeah.
Yeah.
For you, where can people find or reach out if they would like to, they're more interested in using you?
So my practice is Wilmington Functional Medicine.
Okay.
You can find us at wilmingtonfunctionalmedicine.com. We're on Instagram at I'm going to have to say it, WILMFXNMED.
Okay.
Perfect.
And you could just call the office at 910-444-9438. And one thing that we offer is actually 15-minute discovery calls.
Okay.
These are complimentary. And so you can schedule a call with someone in our office to determine if what it is that you're seeking is something that we can actually provide for you. We certainly don't want anyone to come in with unrealistic expectations or come in thinking that we're going to give them something that no one else has been able to.
Yeah.
Give them the same thing. Give them, I don't know. I mean, a lot of our patients have been through the ringer.
Yeah.
Through the ringer, right? And so some things I absolutely can't handle. And if you need medication management for something, I'm going to refer you elsewhere. But that can also happen on the discovery call.
Oh, that's great.
Yeah, so we offer those complimentary for people.
Perfect. We'll add all that in the show notes too. So if anyone needs to see it physically, we'll have it down there for them too.
Yeah.
Don't worry.
It's a lot of words.
Spell. So we'll let Tyler type it out and add it in there.
Okay.
And then I'll edit it.
Yep.
But I just really want to say thank you for coming on. It's been amazing.
Thanks for having me. It's super fun.
Yeah,
I love to talk about what I do. I love to talk about what I'm passionate about. And I really like helping people.
That's great. Yeah, you can definitely feel it through the podcast too. I appreciate it.
Yes.
Awesome. Thanks, you guys.
Yeah. I love you guys. Follow us on all the social media ads. Leave us a 5-star review. And if you have any questions about how to leave a review or just any questions in general, hit us up on Instagram.
Yes, sir.
Cheers.
Cheers.